So in this part we'll discuss about the clinical anatomy. So in this clinical anatomy of the breast cancer, breast carcinoma of breast is very important. Malignant tumor in the breast is the carcinoma of breast. It is the most common cancer. As you can see, it is the most common cancer in females between 40 to 60 years of age. In this period of age, females are more susceptible for breast cancer. So the upper lateral or outer quadrant of the breast is the frequent site of carcinoma. See, this is the upper lateral quadrant of the breast is the frequent site of the carcinoma. More chances of developing tumor in this region. In about 60% cases, upper lateral quadrant is the site of tumor growth. You have to notice that. It arises from the epithelial cells. See, lining the large ducts. See, this is the lobe. You can see the ducts, ductules. See, acini, alveoli. So here, see, you can see the lining of epithelium. From these epithelial cells, the abnormal division, uncontrolled division, abnormal division of the cells takes place. That transforms into the tumor mass. So arises from the epithelial cells of the large ducts. See, those are lactiferous ducts or acini of lobules. See, acini. Here lobule, in that lobule you can see the acini. So the cells lining those lobules where the tumor develops. And if you come down, so you can see here, cancer of mammary gland is the most common cancer in female of all ages. It is more frequently seen in postmenopausal females because after menopause there is less production of estrogen, right? So due to lack of estrogen hormone, after 50 years the menopause is attained by the female at the age of around 50 years, right? So after 50 years, 40 to 60 years in between, so there is lack of estrogen hormone in the body of the females. So that lack of estrogen is a risk factor for development of the breast cancer, carcinoma of the breast. So clinically presents with, if the female had developed the carcinoma of breast, clinically she will be presented with the presence of painless hard lump when palpated. So breast becomes fixed and immobile due to infiltration of suspensory ligaments by cancer cells. These cancer cells will infiltrate the suspensory ligament. You know that suspensory ligaments will catch hold the breast in position, right? So these cells infiltrate into the suspensory ligament and make immobile and fixed. So the breast becomes fixed and immobile. And third is clinical representation. Retraction of skin. The skin pulls inwards, creating dimples. Like skin will become like contracted. What I can say is it becomes contracted, pulls inwards, creating dimples, small hole like slit like dimples. So cancer cells may infiltrate the suspensory ligaments. The breast becomes then fixed. Contraction of ligaments can cause retraction of the skin. This contraction of the ligaments. So you can see that if this is the breast, you can see that suspensory ligaments, cells will infiltrate suspensory ligaments and it will become fixed. So the skin will start to contract. So retraction or puckering of skin, the foldings, inward foldings of the skin. Retraction of nipple. This is very important. Retracted nipple is a sign of tumor. It is a sign of tumor in the breast. Retraction of nipple. So what I can say is, see, if you see, this is the breast, this is the nipple. The nipple become retracted. It will become like this. It will become like inwards or inverted, like retracted, contracted inwards. Like this, it will become like this. it will go inwards, contract inwards, inverted. So retraction of nipple, retraction of nipple. So again, it is a sign of tumor, as you all discussed. Infiltration of the lactiferous ducts and their consequent fibrosis can cause retraction of nipple. Same story. The infiltration of the cancer cells will eventually make the nipple to retract. And the pudy orange appearance of the skin. It is like a skin of the orange color pigmentation type of thing you can observe at the skin of the breast. So it is caused by obstruction of superficial lymph vessels by cancer cells, may produce edema of the skin. The skin of the breast become edematous, giving it an appearance like that of a skin of an orange like leathery skin, and orange kind of a pigmentation you can observe there. So that is the orange appearance of the skin. This is very important, you have to remember. By visual inspection only you can able to see that okay, the orange of the skin is observed at the site of tumor. Metastasis. This concept is very important. Metastasis is defined as the spread of cancer from its primary site, that is breast, upper lateral quadrant of the breast, to other parts of the body. So the tumor that is developed in the breast can metastasize to other parts of the body, like ovaries, brain, liver, anything, bone. So bone, it can metastasize to any organ. So we'll discuss how it will metastasize. So lymphatic drainage of the breast. Clinical importance. The lymphatic drainage of the breast is the prime responsible for this metastasis. High percent of occurrence of the cancer in the breast, so it's due to lymphatic drainage of the breast. So dissemination of the cancer cells along the lymph vessels to the regional lymph nodes. The cancer cells will spread to regional lymph nodes. From there it will go to the different parts of the body. Example for that is Quickenberg tumor. This Quickenberg tumor can be asked as essay also. From that they will ask about the extent, the blood supply, everything, the clinical anatomy of the breast. So you have to remember this clinical case scenario. Quickenberg tumor. They'll say that a female patient of age 55 years of age has a tumor. Like they will say that the features, like she has a pretty orange appearance on the skin of the breast, and hard lump is detected in the upper lateral quadrant of the breast, and she is noticing secondary tumor at the ovary. So what is that? So it's a Quickenberg tumor. It will metastasize to ovary. Here you can see in this illustration the tumor mass. This is the tumor mass. This tumor mass is migrating. See, it is metastasizing to the inferior medial quadrant. See, this is medial quadrant. From that it is going to subperitoneal lymph plexus. We have discussed in that lymphatic drainage, right? There will be subperitoneal lymph plexus. From that, transcerebral migration. So transcerebral migration, it will metastasize. It will go to ovary and it start developing there, start dividing there and becomes secondary tumor over there. So this is the Quickenberg tumor. You have to remember that. Distant metastasis. This is so transcerebral migration. So this is from the BDC textbook, BDC or ASO textbook. The lymphatic spread of breast. See, this is the breast. So internal membrane. These are the lymph nodes. You can see. So it can go to humerus, bone cancer. It may develop. It can go to ribs, sternum, bone region, spine. It can go to liver. It can go to ovary. It can go to femur bones. So this is the metastasizing ability of the tumor mass. So because of communications of the superficial lymphatics of the breast across the midline, cancer may spread from one breast to other breast. So one breast to other breast it can spread due to superficial lymphatics communications. Note. because of communication in lymph vessels with those in abdomen. So abdomen also we have a subperitoneal lymph plexus. So cancer may spread to liver, secondary tumors like segmental veins to vertebrae, as you can see here, vertebrae, abdomen to pelvis, it can go to the pelvis and it can reach to ovary. So segmental veins, vertebrae, brain, it can also metastasize. So these are the complications of that metastasizing ability of the tumor. So how can we detect that breast cancer? So early detection of breast cancer. Breast cancer is a serious and often a fatal in women. This is serious complication. So detection is basically based on mammography. This is the technique to detect the breast cancer. And self-examination of the breast. Like every female has to know this, because self-examination can be early safe in, what we can say is, if we can detect it early, we can have a good prognosis, good cure for that. If it is not noticed by the female, it can go to great, like last stage of the cancer, and it may be fatal also. So mammography, it is an X-ray examination, radiation technique of the breast to detect cancer. The mammogram is the X-ray picture of the breast. Mammogram is the X-ray picture of the breast. Early sign of breast cancer we can detect. Characteristic mass or microcalcifications also we can detect. So from that mammography we can detect. So as we all know, gram is the X-ray picture of the breast. Graphy is the technique, X-ray examination technique to detect the cancer of the breast. So this self-examination of the breast involves 6 steps. Inspect, as usually you can inspect the symmetry of the breast and nipples. If the breast is hanging or it is asymmetric, so you can observe that okay, some mass is there or like in the breast, that making the breast to fall down. So you have to inspect what symmetry of the breast and nipples, change in color of the skin, like we have discussed earlier, Hudi orange. So like that kind of thing is there or everything is normal, you have to inspect change in color of the skin. Retraction of nipple is a sign of cancer, we have discussed about. Any retraction of nipple is observed, you have to see. And discharge from the nipple, any discharge is coming out of the nipple on squeezing it or simply by observing it, any discharge is there over the nipple, you have to observe. Palpate all, it is important, palpate all 4 quadrants with the palm of hands. See, only with the palm of hands, slowly, not any palpable mass is there. So you have to place your palm of hand slowly and you have to palpate it slowly, as it is soft, right? So you have to palpate slowly and note any palpable mass, hard mass, if any mass is there over the breast, in the breast, so you have to notice it. Raise the arm to feel the lymph nodes in the axilla. So raise your arms so that you can feel the lymph nodes in the axilla. You palpate slowly any swelling is there or not, any prominent lymph nodes, so you have to observe those. So this is the technique. Mammography is an X-ray technique that uses radiation to create images of the breast tissue to screen for detect abnormalities like breast cancer. Breast cancer. This is nothing like, this breast will be placed in these 2 compression pedals and it will compress slowly and the radiation falls over it and the radiation will fall on it like this. Radiation will fall on it and it detect and images are produced so that we can see here, see the cancer mass of cells. This is normal mammogram where you can see where you are not able to see anything, any hard mass. So benign cyst, not a cancer, this is benign cyst like thing. So you can see here, but the cancer you can see clearly, it encapsulated like thing. So it's not encapsulated, malignant, right? So it is spread irregular borders, you can see irregular borders, metastasizing tumor. So irregular borders, this is the cancer. This is the image that is produced from this mammography technique. So treatment. So treatment. What is the treatment for the breast cancer? It is surgical treatment. Surgery is the option to resect that tumor. Lumpectomy is the removal of only tumor. Only tumor. Mastectomy is the removal of one or both breast. This is complete removal of the breast. If the cancer cells are dividing abnormally and are metastasized over, like it spread over the full breast, so mastectomy is the only choice left, because it may metastasize to other body parts, so it can be fatal. So removing the breast is the choice, the only choice if the cancer cells are widespread. So lumpectomy, mastectomy, these words are very important for you as you are in the first year. So these will be repeated again in your surgery, like this. So you have to remember radical mastectomy. So this is a very important note. Radical mastectomy, classical operation. Whole breast is removed along with the axillary lymph node, because lymph nodes, lymph vessels, lymphatics are present, right? So are the spread of cancer cells are high predominantly by lymphatic drainage. So most possibly those cancer cells will get to adjacent lymph nodes, like that. So the first lymph node is the sentinel lymph node, right? So classical operation involves whole breast removal along with the axillary lymph nodes, because there is a higher chance of spreading these cancer cells to the lymph nodes. So axillary lymph nodes removed, and the pectoralis major muscle and minor muscle if in case. So note down sentinel lymph node, as I said now. The first lymph node draining the tumor bearing area is called sentinel lymph node. These terms are very important, so you have to keep in your mind. Removal along with the tumor in suspect of spread from, because there is a recurrence of tumor mass may be seen in future if you are not removing those lymph nodes. So make sure that to remove those sentinel lymph nodes possible. So in the next part we'll discuss about embryology. Thank you. Stay tuned.